Hello, pharma aspirants. Welcome to Pharma Syndrome YouTube channel. I hope you are subscribed to our channel. If not, means subscribe to our channel immediately for more interesting and crazy information, learning in easy way. So, anyway, enter into the session. In this video, I am discussing about drugs useful for treatment of asthma. As you know already, asthma is a lung disease. It is mainly because of excess constriction of bronchial smooth muscle, which leads to narrowing of the air passages, and especially it may also develop inflammation in the lungs also. So generally, the slowly development of asthma leads to severe inflammatory disease. And the main thing is because of hyperactivity of the bronchial smooth muscle. That hyperactivity of bronchial smooth muscle means increasing contraction of bronchial smooth muscle will make a narrowing of our airways and leads to obstruction in the respiration. So here, the mnemonic for the drugs for asthma is ML bag. So list of drugs are there. With that list of drugs, you can remember easily by using the mnemonic that is ML bag. So M means mast cell stabilizers, and L means leukotriene receptor antagonist, and again L means 5-lipoxygenase inhibitors, and B is bronchodilators, and A is anticholinergics, and again A is anti-IgE monoclonal antibody drugs, and last G is the glucocorticoids. Okay, so here is the first mast cell stabilizers. First is the mast cell stabilizers, like examples like sodium chromoglycate as well as nedochromyl sodium, and these are the examples comes under the mast cell stabilizers. So what is the need to stabilize the mast cells? When mast cells are degranulated, they releases the contents like histamine and other mediators, which increase the allergic reactions in asthma. So we have to reduce allergic reactions in asthma for safetyness of the patient. And examples like sodium chromoglycate, nedochromyl sodium ketotifen are mast cell stabilizers. And next one is leukotriene receptor antagonist. Here, these drugs are used to block the leukotriene receptor to prevent the binding of leukotriene. And drugs like Jafirlukast, Montelukast, so cast are the cysteine leukotriene receptor antagonist. So generally leukotriene receptor antagonist, and these are called as cysteine leukotriene receptor antagonist. So cysteine is one of the active amino acid in the leukotrienes. As you know, leukotrienes increase the bronchial smooth muscle contraction that leads to increasing narrowing as well as inflammation in the lungs. So next, 5-lipoxygenase inhibitor. The main selective drug is the glutathione, and misoprostol may also having the inhibitory effect on the 5-lipoxygenase. So 5-lipoxygenase is one of the enzyme responsible for the leukotrienes. So leukotrienes are not good for the asthma patient. So leukotrienes may increase the bronchial constriction and increase the narrowing of the air passages, and leukotrienes may also increase the inflammation in the asthma. So lipoxygenase inhibitor is the glutathione, and misoprostol also may inhibit. You know, misoprostol is a prostaglandin E1 analog. It is useful for the treatment of NSAID induced ulcer also. And next, bronchodilators. So here importance is bronchodilators name itself indicating they dilating the bronchial smooth muscle. So dilation of bronchial smooth muscle is essential to relaxation of the bronchial smooth muscle and widening of the airway passages in the lungs. And example, selective drugs, sympathomimetics. So sympathomimetics means they are agonize the beta-2 receptors present on the bronchial smooth muscle and causes dilation or relaxation of the bronchial smooth muscle and maintain the proper respiration in the asthma patient. So short-acting drugs like, so in short, S, salbutamol, and T is terbutaline. And long-acting drugs like bambuterol, salbuterol, as well as formoterol. And non-selective category drug is the adrenaline. As you know, Adrenaline is one of the major neurotransmitter in the sympathetic nervous system. The role of adrenaline on the lungs causes dilation of the bronchial smooth muscle. And adrenaline is a non-selective because it can show action on the beta 2 as well as beta 1 receptor. Next, methylxanthine derivatives. Methylxanthines and derivatives. Mnemonic is EDTA. So like etophylline, doxophylline, theophylline, aminophylline. So all these drugs inhibit the phosphodiesterase enzyme in the lungs and increase the cyclic AMP levels. That is cyclic adenosine monophosphate. So the increased cyclic adenosine monophosphate on the lungs increase the dilation of bronchial smooth muscle, which is essential in the asthma patient. And next is the anticholinergic drug. The trick is IT. So I means ipratropium bromide and T means tiotropium bromide. Both these drugs are semi-synthetic derivatives of atropine, which is from the naturally Atropa belladonna, belong to the family Solanaceae. Okay. And what is the need of anticholinergic drugs? The name itself indicating these drugs are anticholinergics, blocks type 3 muscarinic receptors on the lungs, decreases the bronchial smooth muscle contractions. As you know, so these drugs are opposing the acetylcholine. Acetylcholine role on the lungs is constriction of bronchial smooth muscle, but contraction or constriction of bronchial smooth muscle not required in the asthma patient. And next is anti-IgE monoclonal antibody. So omalizumab is a monoclonal antibody oppose the IgE antibody function. IgE function. So here IgE responsible for the severe allergic reactions. But in asthma, severe allergic reactions may develop into the inflammation also. That's why we have to oppose the IgE antibody action by using monoclonal antibody omalizumab. And next is the glucocorticoids. These are the steroidal compounds, and especially glucocorticoids are having excellent anti-inflammatory action because of the reason if asthma is with inflammation, severe inflammatory asthma condition, glucocorticoids are the first choice because of their excellent anti-inflammatory properties. And in this two category, inhaled by using inhalation. Mnemonic nothing but trick is BFC like KFC. BFC means remember KFC. So budesonide, beclomethasone, fluticasone, cyclisonide. These are the drugs comes under inhaled category. Next systemic category directly into the blood through IV route. Drugs like methylprednisolone, hydrocortisone, prednisolone, and the trick is MHP, most happening place. So this is a simply you can easily remember drugs for the asthma by using tricks as well as interesting mnemonics. So like this crazy and interesting information in the way of easy learning regarding pharmacy. So subscribe to our channel and share to your friends. All the best. Thank you.